Good evening, ladies and gentlemen. My name is Frederick Covington, and I'll be providing a brief overview of the Brothers organization as well as introducing tonight's keynote speaker. Brothers is an organization with a profound mission to nurture, to organize, to fortify, and to motivate males of the African diaspora within the occupational therapy profession, spanning from academia to practice. At its core, Brothers recognize the importance of representation and empowerment within occupational therapy, particularly for individuals who identify as male and belong to the African diaspora. The organization is driven by a commitment to cultivating a supportive community that fosters the personal and professional growth of its members. Through various initiatives, Brothers strives to provide a platform for networking, mentorship, and skill development, empowering its members to thrive in both academic and clinical settings throughout their careers. And now, on to our keynote speaker. Jamar Haggans serves as the Director of Quality at the American Occupational Therapy Association, where his primary focus is to advocate for the inclusion of the occupational therapy profession perspective in national discussions on quality and value in healthcare. Now, Jamar's journey in occupational therapy began with the completion of his Master of Science degree at Belmont University in Nashville, Tennessee, where he distinguished himself as a recipient of the Distinguished MSOT Student Award. His academic achievements laid a solid foundation for his subsequent professional endeavors. Now, with this wealth of knowledge and of experience in post-acute care settings, Jamar has honed his skills both as a clinician and as a multi-site manager. This hands-on experience has provided him with valuable insights into the challenges and opportunities within the healthcare landscape, particularly in relation to quality improvement and patient care outcomes. Now, outside of his professional commitments, Jamar resides in Kansas City, where he enjoys immersing himself in the vibrant local jazz music scene. Additionally, he takes advantage of the city's extensive network of bike trails, finding relaxation and rejuvenation in the great outdoors. Through his dedication to advancing the field of occupational therapy and his commitment to enhancing quality standards in healthcare, Jamar continues to make meaningful contributions to both his profession and his community. Ladies and gentlemen, I present to you Mr. Jamar Haggans.
Thank you so much, Dr. Covington, for that wonderful introduction. Welcome you all. I'm honored to be here with you all, and I'm looking forward to sharing a career journey in healthcare quality, and more importantly, my career journey in healthcare quality. So just to lay the foundation of the conversation today, I'd like to give you all a glimpse into my professional journey, provide a high-level overview of what healthcare quality is, review some common job titles in healthcare quality for those who might be interested. I want to provide an overview of AOTA's quality department, and most importantly, leave you with some key takeaways. And hopefully, we do have time for a Q&A at the end. So as Dr. Covington said, my name is Jamar Haggans. I am the Director of Quality for AOTA. And before we go any further, I'd like to tell you a little bit more about myself. And if you are wondering, I am the handsome young man here in the white hat, accompanied by my mother, my grandmother, my great-grandmother, and my great-great-grandmother. So I was raised by my grandparents in a very small town in Arkansas that is close to Memphis, Tennessee. Like a lot of people that grow up in small towns, there was a really strong sense of community. And that really played a key role when I look back into who I am today and how I got to where I am today. So I didn't know what I wanted to do professionally until late in high school when I actually was asked by my grandmother to sit with one of my elderly neighbors who was suffering with terminal cancer. My neighbor was a really, really good person and really a matriarch of our community. And her husband had died a few years before. So she was lonely and she was again going through the cancer diagnosis. So one day when I was sitting with her, her home health OT came. I had no clue what OT was. I'd never seen one or heard of one before, but with my neighbor's blessing, I was actually able to watch part of her session. And that was my first introduction or exposure to occupational therapy. Again, I'd never heard of OT. I never knew anyone that was an OT, nor did anyone in my family. And after doing some research, I found out there was only one OT school in the state of Arkansas. So, although my family did not know any occupational therapy practitioners, they were very supportive of me going to college to pursue an education in occupational therapy, even though I took some detours along the way. So, usually, a typical career path in OT is straightforward. You go to OT or OTA school, complete your field work, transition to become a direct care practitioner. And some people even transition into leadership roles or in academia. And that is a great path. I've seen a lot of people had a lot of success with that path. However, it's not my story. So I started out my career in rehabilitation as a physical therapist assistant. And I enjoyed it. It was, yeah, it was very fulfilling. A few years later, I became the rehab director at my facility. This wasn't planned at all. The position was open and I was asked, and I said, sure, why not? Now, even though at that time I had been exposed to occupational therapy and I really wanted to do occupational therapy, but the university I went to did not have an OT program. So I was practicing as a PTA and working closely with the other professionals that were in my facility. And as I worked with the OT practitioners, I knew I had the skills to address my clients' mobility needs, but I was so impressed that the OT practitioners not only took care of the or addressed the physical limitations, but the attention to the psychosocial aspect and the cognitive aspect of the clients. And it really encouraged me to pursue that dream of OT even more. So I went to OT school, one of the best things I could have ever done. And after OT school, transitioned to become a OT, direct care. Did that. It was great. I learned a lot. I was so glad that I was able to use those skills. And a little bit after treating as an OT, I was asked to take another leadership position. Again, this was not planned. I didn't go to school thinking that I would be a manager. It just kind of happened like that. And after working as an OT rehab director, I stepped into a regional management position. And in my regional position, I oversaw clinical and financial operations of 10 to 15 facilities, skilled nursing facilities, and ortho outpatient clinics. And with that, I would oversee around 60 to 80 physical and occupational therapy practitioners, as well as speech language pathologists. And during this time as a regional manager, I also did a lot of work with multiple facilities to improve quality measures. Now, what are quality measures? Quality measures are tools that measure healthcare outcomes and processes. And if you work in long-term care like I did, you are very familiar with your quality measures, and not only you, but people looking at coming to your facility. have easy access to how you perform in certain clinical areas. So it was very important. And with that, I did a lot of work in my facilities there. We made a lot of improvements, and the operators, everyone in the facility was really able to see the value of therapy, in specific OT. I would joke with or halfway joking with one of my old supervisors and tell him I need more OTs at every facility. Like it's not a question, I just need more, because when I look at, and coming from someone who has supervised all of the disciplines, when you look at OT scope of practice, we really can do so much, so much. And I think personally OT is underutilized, but that's another soapbox, and we're not here to talk about that today. But just know we can do a lot and we can do great things. So with the working quality measures, I volunteered with AOTA because I was doing this day in and day out. And that led to me coming to AOTA as the director of quality. So this picture is actually the first time I was a manager in the facility. As you all can tell, it was quite a long time ago. So how did I get here? I want to start by talking about some things that helped. You don't have to see the whole staircase, just take the first step. Martin Luther King Jr. That quote really speaks to my first point of being open to new tasks. I hadn't planned on being a manager, but I was open to learning. And that one decision has been a catalyst to my career and even encouraged me to be open to more tasks. It wasn't easy. I would be untruthful if I told you or even hinted to it being easy, because it was not, but it was worth it. Some other things that were really important and are still important is developing the leader and learner within. Leadership is a journey, not a destination, and developing as a leader is a continuous process. And these skills can be learned just like anything else. And you don't have to be in a leadership position to start working on these. So things like communication, relationship building, time management, conflict management are really important skills, whether or not you're in a leadership position. Communication is first there. One thing that I worked on with a lot of therapists and especially rehab directors is we are so good at communicating clinically to other OT practitioners, but how do we explain those things to a non-OT professional? So if you're talking with an operator, how do you get buy-in? And that is a skill, and I've seen people get much, much better with that. So it just goes to say leadership skills, like a lot of other things, can be developed. Another thing that's been really important is being willing to learn and relearn and learn again. As I said previously, I hadn't planned on being a manager, so I had to learn, and I had to learn a lot. And it wasn't just leadership skills, it was regulatory policies. How do I improve my documentation? How do I coach people to do the same? And that's just a few things. There were so many things that I had to learn and also relearn. Um, I really, really paid attention to also making sure that we were current with evidence-based practices. So as we're working to improve the outcomes with our clients, one way that we can do that, and the best way to do that, is making sure we're implementing evidence-based practice and current clinical guidelines. And if you've been in the field for a while, you know that changes. So again, you have to be willing to learn and relearn. And that's whether you're treating a client or if you are a manager, it's even more important that you learn those things so you can guide therapists to incorporate those best practices so they can continue to grow and get the best outcomes with their clients as well. Something else is adding value, and not just adding value, but being intentional about adding value. And this can be different depending on your setting, your patient population, your company. It really starts with identifying a problem and trying to be part of the solution. So for me, being intentional about adding value was advocating for OT's value in addressing quality measures like falls, wounds, weight loss in my facility and in my region when I moved into a regional manager role. Keeping up with coding changes at my company when we didn't have anyone else to do that, and helping with education strategies. Or being intentional about adding value was also seeing that some of the facilities that I was overseeing was struggling with their state surveys. So developing best practices for rehab staff so we could work with our nursing partners to improve our survey outcomes. Now, with this being said, I do want to mention that you have to be kind to yourself and recognize when you might or might not have the bandwidth for this. So, if you're starting in a new role, I would recommend learn your role first. If you can be intentional about adding more value, that's great, more power to you. But being realistic with ourselves is always a great place to start. Now, I wish I could tell you all that it's been all sunshine and rainbows for me, but it has not. So we all experience barriers in our professional journey, and those can be external barriers or it could be internal. Today, I want to talk about a barrier that countless people, including myself, have or will deal with at some point in their career. That barrier is imposter syndrome. Or for some people, it might be that feeling like you don't belong or you don't deserve here because I'm not enough. And a lot of times we might say, I'm not smart enough. I'm not experienced enough. My background isn't impressive enough. I don't talk like the people here. And certainly I might not look like the people here. According to Maryville University, Black men and women are more vulnerable to imposter syndrome both in the workplace and in day-to-day interactions. However, sometimes the very things that make us feel like we don't belong can be a hidden superpower. I watched some people in my family experience very hard things during my childhood and in my early adulthood. And it made me feel like I didn't belong in a lot of spaces. However, I began to realize that my lived experience helped me sympathize with my clients more and develop a better therapeutic relationship. And I had to learn for myself that going through those hard things made me stronger and not weaker. Also, my first job was in Memphis, Tennessee. So my Southern accent made patients feel like they could talk to me and they could trust me. I bring those things up because sometimes the things that make you feel like you aren't enough are the very things that make you more than enough. So let's switch gears and talk about a topic that is very near and dear to my heart, healthcare quality. Healthcare quality is the degree to which healthcare services for individuals and populations increase the likelihood of desired health outcomes and are consistent with current professional knowledge. So I'm sure you all have seen, heard a lot more about healthcare quality in the last few years and even decades, and you might be wondering, why is it so important? Well, if you look at where we are compared to our peers, it really helps you put things in perspective. So, according to the Commonwealth Fund, the U.S. has substantially more deaths that could be avoided through effective public health and preventive interventions and through timely and effective healthcare interventions. So you can see here, there is a pretty big gap compared to everyone else. To add to that, non-Hispanic Black Americans live on average 4 years less than non-Hispanic white Americans. That is a problem. So if you look at our spending, the US spends so much more on healthcare than other high-income countries, but we have worse outcomes. And quite frankly, our healthcare spending is unsustainable right now. Many payers, such as Medicare and Medicaid, are implementing value-based payment systems where payment is based on outcomes and quality instead of the volume of services provided. So you can find value-based payment systems or programs rather in hospitals and throughout post-acute care. And if you've been working in post-acute care for a while, like me, you might, or I'm sure you can recall the shift where therapy minutes were more driving reimbursement to really now look at clinical outcomes and clinical characteristics of our clients. So this is the shift of healthcare right now, and you can see why, because the paying for volume of care provided isn't getting us anywhere as far as outcomes. So that sets the stage a little bit. And now we'll talk a little bit more about healthcare quality. And I will tell you, healthcare quality is such a big topic. Today, we are just going to be scratching the surface. In 2001, the Institute of Medicine released a landmark report titled Crossing the Quality Chasm. And this report laid the foundation of how we look at healthcare quality even 20 years from when this report was released. The report outlines 6 areas that should be addressed to improve quality, and those areas are safety, effectiveness, efficiency, patient-centeredness, timeliness, and equity. This report is actually the second report in a series looking at the quality of healthcare in the US. The first report, To Err is Human, focused on the thousands of people dying of medical errors and accidents every year in the US. So we'll dig into those areas a little bit more, starting with safety. So avoiding harm. How can we ensure that the care that we provide is free from harm and we're avoiding injuries to the patients from care that is supposed to be intended to help them? I'm sure you all can recall or think about safety practices that are in place in your facilities today. Post-acute care, transfer or gate belt is always something that standard policy. We usually do it to help keep our clients safe. The second area is effectiveness, and effectiveness refers to providing services that are evidence-based and not providing services that the clients are likely not to benefit from. A great way that we can make sure that our care is effective is by looking at the clinical practice guidelines and systematic reviews from AOTA and translating that knowledge into our everyday practice. The next area is efficiency, and efficiency looks at avoiding waste and improving processes. So waste can be equipment, supplies, and even energy. I do want to point out that OT practitioners are so good at process improvement because of our skill of activity analysis. So being able to see all the pieces in the puzzle, and it really helps. And in my opinion, it makes OT professionals stand out from other people working in the process improvement space. Next is timely. How can we make sure that we are providing the right care to the right people at the right time? Depending on where you look, timely is also referred to as access, because if people can't access the healthcare services, then they're definitely not getting the services on time. Patient-centeredness, and that refers to the care or ensuring the care that we provide is respectful and responsive to our individual's clients' preferences, needs, and values. Capturing information like our clients' occupational history, their interest, values, personal and environmental factors, and barriers to occupations, using the occupational profile is really foundational to us ensuring that the services that we provide are client-centered. And last but not least, equity, and making sure that care is equitable. And that's really looking at, do people get the same quality of healthcare services regardless of their race, their ethnicity, or socioeconomic status? Health equity is a really big topic right now, mostly focused around addressing social determinants or drivers of health. And these social drivers of health are conditions in the environment where people are born, live, learn, work, play, and worship that impact functioning and quality of life. And according to the World Health Organization, social drivers of health can account for between 30 and 55% of health outcomes. And that's not even looking at the healthcare services they get from the system. It's saying these factors, these social drivers of health can be even more important than the actual care that people get. And when you take a moment to think about that, I think it's really, really powerful. So a lot of that was really high level, but I don't want that to be off-putting because healthcare quality really starts with each one of us. And many people that work solely in quality now started by looking at how quality is measured in their where they're working, or joining the quality improvement teams, or or even being involved in the quality improvement meetings. Right now, you can start incorporating more healthcare quality principles into your work by looking at, are you getting the intended outcomes? If not, why? What can you change? Are you using outcome measures with your documentation? Do you know how quality is measured at your organization? Or is there a process at your job now that you know could use some improvement? Process improvement, again, really, really big part of quality, and getting a head start on learning that can be helpful, regardless of if you plan on going into a specific quality role or not. So sometimes when I talk about healthcare quality, a lot of people ask, so if I were to search on LinkedIn or Indeed, what are some of the job titles that I could search for? And these are some, so quality manager, director of quality, quality assurance manager, director of quality improvement. I won't read them all, but you all see them there. A lot of these roles focus on patient safety, process improvement, compliance, clinical outcomes, and much more, because as you all saw, healthcare quality is a really, really broad topic. I do want to note that we do member spotlights for AOTA members that are working in quality. And this is another great way to learn about what OT practitioners are doing in quality. So this is one of our quality spotlights. And if you're here and this is your first time seeing me, if you look there, you might also see someone familiar. So what does quality look like at AOTA? Quality is a multidisciplinary team with members of the practice, policy, and data science teams. We work to ensure that occupational therapy is included in national quality and value conversations. A lot of our work looks at performance and quality measurement. We also do a lot of work around interoperability, or the exchange of healthcare data. Also, payment and policy changes related to quality. Engagement with external quality stakeholders, that could be Medicare or other organizations that are looking at quality too. And we also have quality resources for our members, including resources for changes to payment and care models, evaluation checklist, and our evaluation checklist for acute and our post-acute care settings actually lists quality. So when I asked or said that you could get started now, you can check out one of those checklists and see how quality is measured in your setting. Member spotlights, as I mentioned previously. And we also have a quality toolkit that has assessments and standardized tested screens across the lifespan that you can use. So why is quality important to OT? First, OT practitioners need to be able to answer the why. If systems are looking at efficiency, effectiveness, safety, they might ask, why do we need OT providing this service and instead of another discipline? Occupational therapy practitioners need to be able to show our outcomes. Also, we need to be able to document the clinical reasoning for the treatment provided. Those clinical guidelines really come in handy with that. More payment and policy reform is on the way. So, as I briefly mentioned previously, the healthcare system is changing and really moving from paying for volume of care provided to paying for value and looking at those outcomes. So, we've covered a lot of information in a very short period of time. Um, One thing I want to do is provide you with some key takeaways. First, change is constant. The world is moving fast and there are new opportunities out there. Change in itself is an opportunity. Being able to advocate for yourself and occupational therapy is such an important thing because we bring such a unique skill set to any table that we're at. Look for opportunities. Start small. How can you add value and get involved? It could be, are you using outcome assessments? Is there a process at your current job that you think needs to be improved? Do you know how quality is measured at your facility or at your organization? You are enough. And I want to repeat that again for all the people in the back. You are enough. Remember that sometimes the things that we think make us weak or make us feel like we don't belong can be our greatest strengths. Your unique experiences make your contributions valuable to any environment that you're in. Keep learning. Anyone who knows me well knows I love listening to podcasts. And I listen to podcasts because it's something I can do while I'm driving, while I'm working out, or while I'm folding laundry. Here are some of the podcasts that I listen to. All these podcasts are free and you can get them wherever you stream your podcast from. And AOTA's podcast in particular, you can get a contact hour from by just taking a short survey. So I'll just go through some of them. Health Policy is a great podcast for healthcare policy, and it keeps me up to date on healthcare policies that might impact occupational therapy. Of course, AOTA's podcast is great for keeping up with evidence-based practices. I was just listening to the Alzheimer's Practice Guideline podcast in the gym a couple days ago. I learned a few new things. Again, we keep learning, you learn, you relearn. Um, Coaching for leaders, I really like this podcast. It's been pivotal in my leadership development. Just they have a lot of different people that they bring on from a lot of different perspectives. So that's just to name a few. I encourage you to find what works for you. This works for me, and it took me a little bit to find what works for me. So when you do find what works for you, go all in. Another thing I wanted to talk about is the importance of being involved at the state and national level. We need more representation, but that doesn't happen if you don't engage. There are so many opportunities that um, people wouldn't otherwise know about unless they were involved in their state or national organization. These places you can learn from other practitioners, get practice resources. They were definitely helpful for me. I can remember when the Choosing Wisely came out, and I reviewed that with every single, at the time I was a regional manager, and I reviewed that at every single facility that I went to. So again, the practice resources, professional development and advocacy. We need advocacy. That's a whole nother talk, so I won't go into that, but advocacy is very important to each one of us. AOTA represents more than 230,000 occupational therapists, occupational therapy assistants, and occupational therapy students in the US. So, if you are interested in learning more about anything that I talked about, you can do that pretty much from most of these websites here. Just as an FYI, the quality page at AOTA, the occupational profile. So going back to patient-centeredness, the evidence-based practice webpage, looking at those clinical guidelines, the Agency for Healthcare Quality and Research, Healthcare Research and Quality, the Institute of Healthcare Improvement. They have a really, really good process improvement toolkit that I often refer to. Healthy People 2030, I'm proud to say that AOTA is a Healthy People 2030 champion. The work around Healthy People 2030 is largely focused on addressing those social drivers of health and looking at health equity. And the National Association for Healthcare Quality, some people ask, is there a quality certification? And NAHQ does offer the CPHQ, the Certified Professional in Healthcare Quality. So I want to leave you all with one of my favorite quotes by Martin Luther King Jr. If you can't walk, then, or excuse me, if you can't run, then walk. If you can't walk, then crawl. But whatever you do, you have to keep moving. Thank you.
Thank
And
you so
now,
much.
ladies and gentlemen,
Nope. Go for it, Fred. No problem.
I was just going to say, tell the audience that we'll open up the floor for questions. You can either ask directly or you can post your questions in the chat. And if you all don't mind, I'll start off with questions.
Thank you.
Because it's a very interesting presentation. Now, as a leader in my own organization, what I found challenging was going from a clinical mindset, as you know, as when the patient take precedence,
Mm-hmm.
to going to the business mindset or the leadership role.
Mm-hmm.
Was that a difficult transition for you?
I think the most difficult transition there was learning about the financial part of everything. I didn't learn about looking at a profit and loss statement in OT school, or what an operating margin was. So that was difficult. But one of the things that I always say, and I always tell people, because a lot of times, especially in the skilled nursing environment, people can be somewhat apprehensive about going into leadership roles. And it's been my experience that if you take care of the patient first, then everything else falls into place. So, yep, we have to look at finances. There is no mission without a margin, but you can do those things by making sure that we keep the patient first and really taking care of their needs.
Okay, thank you.
Mm-hmm.
Jamal, feel free to ask your question. You can unmic yourself and ask your question. Thank you.
Yes, great presentation. Excuse me. Can you hear me? Can you guys hear me?
We can hear
Now
you.
we can hear you.
Okay.
Good.
Hi, Jamar. I want to say great presentation for one.
Thank you.
My name is Jamal Smith. I am a level 2 occupational therapy student at Howard University.
Mm-hmm.
And I just wanted to say just a question about as far as an upcoming, for what would you say for, I guess, new practitioners, for people who are interested in maybe not doing a traditional route, but going the non-traditional route before going traditional? What would you say for them?
I think one of the best things that you can do, and this is, I think people now are so lucky to have this. But what I would do is, if you're not on LinkedIn, set up a LinkedIn profile and reach out to people who are in areas that you want to be in. I still reach out to people to learn things now, and most people are interested and they don't mind helping. So I would say look at people who are where you want to be at, reach out, ask questions. I think that's one of the best things that you can do, because they would be able to provide you with some insights that people who haven't been there might not know about. So that would be my advice.
Thank you, Jamal, for that question and that answer. Brandon, you're up, Brandon. You can feel free to unmute yourself and ask your question for Jamal. Thank you.
Good evening. First and foremost, excellent presentation. It's a pleasure to hear this, but also it was a pleasure to meet you for conference as well. One of my questions that I had was regarding imposter syndrome. If you, I put it in the chat, unfortunately my computer went out at that time whenever you were kind of conversing about it, but I just wanted to know, how did you face this and kind of conquer this battle with imposter syndrome? And if you had any words of wisdom, I would truly appreciate that.
Yeah, so I think the first thing I would start out with saying is you don't have to be perfect. No one else is. A lot of times we put so much pressure on ourselves to fit this mold or be like this person. And, we almost force ourselves to be perfect, and that's not realistic. So I think that's the first thing, and really embracing, I don't know, it's different for different people. I definitely had my reasons for feeling like that, and I think that, again, it's different for different people, but embracing those things and knowing that there's something for everyone. Everyone struggles with something. You aren't alone with that. And just because you're struggling with something does not make you any different or worse than anyone else. So that's what I would say. Some other things, especially as you start working, that might be helpful is think about some of the things that you've been able to do at your current job, or when you faced difficulties in school, graduate or undergraduate, and really look at how you overcame those things. And it's the same in our professional lives.
Thank you.
Absolutely.
All right, thank you, Jamar. Next question, Tamiko, if you'd like to unmute yourself and ask your question.
Thank you. Good evening. And thank you again for this presentation. I'm a therapy business owner in North Carolina, and I do not participate in MIPS because I'm not required to because of the volume that we see and based on the criteria that requires you to participate in MIPS. And also because when I looked at it, it seemed very overwhelming. So my question is, do you have any recommendations for any emerging AI platforms that would make it easier to participate in MIPS or to just organize your data for quality measures?
Yes, what an interesting question. I'm so glad you asked that. So I would say when you look at, you say you weren't able to participate in MIPS because of the what we call the low volume threshold. So do you know if you meet all three or you don't meet any of those three criteria?
Well, it's because
go ahead.
because we hire contractors, the way it works is that even though our volume does meet the MIPS requirement, it doesn't meet it for the individual contractor. So we were told we don't have to do it. We can if we want to, but we don't have to. So because it's
Gotcha.
overwhelming to me, we just decided not to do it.
Okay, so what I would say is you might look at an option called opting in. That might be available to you. And if it is, what people in the field tell me makes it easier is using a QCDR. And I can, if you email me at jhaggans@aota.org, I can give you some names of some that would be helpful, and actually even connect you to an OT practitioner who has served as my MIPS expert over the last couple of months. But I'm so glad that you are thinking about it and talking about it. I feel like so many people don't even know about MIPS. So it excites me to hear you even ask about that.
Thank you so much.
You're very welcome. I look forward to hearing from you.
All right, Jamar, there's a question from the chat. The question in regards to what organization that helps get the quality assurance certification? The individual wanted to ask if you could repeat that website for them.
Yep, I can do even better. I will put it in the chat. I'll put the link in the chat.
Thank you, Jamar. Jamar, while you look for that, I'm going to ask you another question just while you're looking for that. Feel free to answer once you're finished, dropping that in the chat. This question was, as rehab leadership happened to you, what were some pearls or nuggets that you sustained through the good and bad times?
Can you repeat that one more time?
Sure, no problem. As rehab leadership, what were some pearls or nuggets that helped you get through the good times and at sometimes even the not so good times? What were some things that maybe helped you get through the good times and the bad times?
So I would tell myself there's always tomorrow. If you can find someone who you can talk to, having other regional counterparts that I could talk to about things made the world of difference. And I'm a very big advocate for 10 minutes. And I would tell my counterpart, hey, I need 10 minutes. And that was code for us when we were having a bad day. We could talk to each other to help us get through the day. So I think having that person there and knowing that there's always tomorrow. Yes, things happen, but it usually doesn't stay bad. I mean, there are definitely tough times, and especially, being in a regional position during COVID was especially difficult. But things get better. Like the song, "Trouble Don't Last Always."
Okay. Thank you so much.
Mm-hmm.
All right, so we have another question, Jamar, for you. How was your approach to addressing social determinants of health, and how has it evolved or adapted, assuming from a leadership position that you were in?
Yeah, so that's a good question. And I will say honestly, I don't know that I can tell you when I was in the clinic, and SDOH is newer and it's not depending on where you are. For instance, I was in skilled nursing facilities and they just put questions about transportation and social isolation, things like that on the minimum data set or the MDS. So people are asking about that now. I don't know that we were I think to 2 years ago, I would not say, or 3 years ago, I could not tell you I was addressing social determinants of or drivers of health. But I think we're already doing a lot of it. So when you look at SDOH, there are certain components, and one is economic stability. So if you have a client that doesn't have economic resources, for our case, we were not recommending high cost adaptive equipment. So that's one thing that you can do there. Looking at the economic resources, what's going to be realistic for that client to get. Also, looking at their access. So do they have access to healthcare services? Transportation is really big. So ensuring that the client has transportation to and from healthcare services when they were discharged from skilled nursing was another big thing. And that's, again, the timeliness or access. Do they have access to care? Connecting to community resources, kind of going back to the economic stability and looking at food insecurity. So food banks, things like that. That's something that we would do. And also just looking at the neighborhood or the built environment. We all have those clients that we say, hey, I know you want to go home to that environment that you were in that has 12 steps to get into. And as soon as you go in, you've got to go down 5 stairs and you can't do it now. Let's see what we can do to get you placed in a handicap accessible apartment. So looking at environments that way too. So I think those are the things that people are probably, not even probably, we're doing those things already. I think it's more of a language. People aren't saying I'm addressing social determinants or drivers of health. But thankfully, a lot more people are aware of looking at the SDOH and health equity. So we can kind of put a name to what we were doing. So that was a very, very long-winded way of saying I might not have had the language 2 or 3 years ago, but those were some of the things that we were doing to address health equity.
Thank you, Jamar.
Mhm.
There is a follow-up on that question, Jamar. So in regards to that language aspect, you said, for example, as an occupational therapy practitioner, you had language, but sometimes it didn't always convert per se, right?
Mhm.
Could you maybe give some tips on maybe for the audience on is the importance of maybe, for example, understanding to use that language when necessary? So, for example, we can make sure that we have that foot or we're at the table.
Yeah, so I think it really depends on the conversation. What I would always tell people is whoever you're talking to, they're looking at a certain thing. So if I was talking to an operator, they were looking at operations or they were looking at census. And I spoke in terms that would appeal to them and they would understand. So instead of saying, hey, we need you to buy all of these very expensive cushions because we want to start a program to reduce the number of wounds or reduce the wounds that are worsening. It was, hey, if you look at our quality measures and people are looking at these things to decide even if whether they're going to go to your facility or not, we're not doing so hot in wounds right now. And if we continue to be like this, our census is going to continue to be low. So I think this is a way that we can make an investment so we can improve in the clinical care. So we're not going to have as many new or worsened wounds. But from your standpoint, it's also going to show in those quality measures. So we're going to be able to bring more people in the door. That's just an example of talking in a way that speaks to your audience. So knowing the audience, really.
Thank you, Jamar.
Mhm.
With that, Dudley, you have a question? Please feel free to unmute yourself.
Jamar, thank you. Phenomenal presentation.
Thank you so much.
I've spent about 5 minutes trying to collect my thoughts with this question because I feel like it's everywhere. So bear with me, give me grace. Um, I've noticed that there are more physical therapists in the realm of, let's call it, corporate roles in relation to health informatics, quality assurance,
Mm-hmm.
patient safety, even health technology. And I haven't seen many occupational therapy roles. As I encounter and connect with potential OT providers and also current let's call it the new wave of occupational therapists, they're discouraged because they look at this sister profession and they say, wow, there seems to be a lot of non-traditional roles. And so what are some strategies? I know you mentioned LinkedIn, and Lord knows I feel like we don't need another platform to have our eyes on and to take away our time. But what are some strategies just to encourage this new wave of providers? Because unlike yourself, who you spent, I would say, a decade in the clinical realm and you went into management, in conversation with newer providers, they're not willing to wait or invest 10 years before transitioning. They're just going to end up leaving the profession overall. Likewise, I've seen other OT providers have supplemental degrees, but with the rate of education, just to achieve an occupational therapy degree, some individuals feel locked in, like, wow, I spent all this money, and perhaps they don't have quite an innovative thought process, or the industry is so locked in because people may not see the value of OT. But again, what are some strategies just to encourage these new providers who are coming in and, after the first month, I've had new providers come in and they say, oh, I want to do something else. And I'm like, you just got here. Like, you just got here. Like, you barely transfer patients. What do you mean you want to leave? And so what are some things that we can, especially in my role as a mid-level provider and advocating for the profession and wanting to keep that spark, what are things that I can do just to again encourage? Because I think more people or less people are volunteering with the profession. Would you say that's accurate?
Oh, absolutely. I definitely believe so. So what I would say first is just looking at the grand scheme of things, there are a lot more physical therapy practitioners than occupational therapy practitioners. So just looking at it from that perspective, you will see more PTs or PTAs in non-clinical roles because there are just more of them. I would definitely just go back to trying to find people in spaces or places where that practitioner wants to be, and reaching out, asking questions. I've learned so much by just asking people things. It really depends, but I want to go back to your another part of your question, because I've also seen where there might be new practitioners that come in a month in, want to do something else. And to that, I would say, and this is coming from someone who trained OT practitioners, PT practitioners, speech language pathologists. When you start, it is okay to feel like you don't know what you are doing. there is a learning curve. And even with the interns and things like that, I think the reality is anytime you go to a new job, there's a lot of newness, there's a lot you have to learn. And just because it just doesn't click and it's fun on day one or day two or week 1 and 2, doesn't mean you need to go anywhere. It means that you are learning. It gets better. It happens to all of us. So I always tell people, hang in there, give yourself 6 months, and 6 months to a year after that, if you still feel the same way, try something else. I would say try a new setting, and not even necessarily setting like going from skilled nursing to inpatient rehab. It could just be a different environment. The environment that you are in matters so much for job satisfaction, really. So even finding a new environment could make a world of difference there. I hope I answered your question, or at least portions of it.
Yes, yes, you did. Thank you so much, because I'm at an impasse with with just meeting new people and hearing just discouragement. Because I think, again, with this new wave of individuals coming in, I think it means it's quite shocking when they see that their peers are in a profession that allows for more flexibility. Not to say that occupational therapy can't do that, but if you have someone in a traditional setting working Monday through Friday, those 8-hour, 8.5, 9-hour days, day in, day out, in a rigid operation system, and the payout is not what it should be. And it can be discouraging for sure. But, as an advocate, you try your best and tell folks, try this and connect with this. But definitely, I've seen levels of discouragement with people, especially with regards to loan payments and quality of life. And it taps into that level of just mental health of, did I make the right decision? And, I remember going out of school and having to pay more money. I'm like, I got to join all these associations. I barely got my first paycheck. And so, but it was funny thinking about it now, but realizing it pays off in the end to connect. But thank you so much.
Right. And I do want to say one more thing too, because you mentioned something and I forgot to address it. When people tell me that, I push back quite a bit on feeling like they need to go to school and get a completely different degree. As I talked about in the presentation, looking at our activity analysis and the skills that we learn about that, applying that to process improvement, therapeutic use of self. I talked about communication. That will help you in so many areas. So there are so many things that we learn in OT school that could be generalized to help us in so many environments. So sometimes I tell people, we learn to use a lot of these skills on our clients. So it's just changing who you think about who you think your client is. And a shift in that mindset usually helps too.
Excellent. Excellent. Thank you.
Absolutely.
All right, next question, Jeffrey.
Well, my question is, well, first of all, I enjoyed your presentation, and I think it was more to as a previous. Which Jeffrey Loveland or Lucas?
You can finish, Mr. Lucas, and then we'll go to Jeffrey Loveland.
I'm sorry.
No problem.
But as a previous manager in skilled nursing years ago, I was finding out that a lot of people were getting burned out due to, the RUG system, PDPM, all these new changes and everything. And there was a lack of support from upper management. And what type of programs or things that you have in place or your organization have in place to support these DORs or these new graduates entering in skilled nursing?
Really good question. So I would say the new grads, I always try to partner them or put them in a place where they had a resource. And that helps tremendously. I think that's one thing that we could do for new grads, and also assuring them that, hey, um, again, it might be scary for the first week or so. I want you to focus on adding value and making sure you don't hurt anyone. Do those things, it gets better, I promise. But as far as rehab directors, one of the things that I did, and this was during COVID, was we did a book club. So and I did not think that the DORs would be excited about this, or let's just say I did not have high expectations until we got started. And it was so impactful for all of us, including myself. The first book we did was The Energy Bus. And each week, it's a very good book. It's small. It's written to where it's very easily digested and easy to read. So that was something that really provided a lot of value and uplifted people, including myself, in a time where things were very difficult. So I think things like that, as small as it was, me buying a $25 book for all the rehab directors and us reviewing that on a weekly basis really helps. So it doesn't have to be that, but something. I think sometimes, people need something. And that's just what I did.
Chef Lofton?
I didn't know I asked a question, but I'll go ahead and ask one. So I have a comment for Dudley with his question before I ask my question. That I'm 65 and I didn't have a cell phone or an Apple phone end up in my pocket until I was about age 50. And young people who have had that technology all their life have just a constant need for immediate gratification. And they can't plant a seed and be patient and watch the seed grow. They want it to happen now. And I've really noticed that change over the course of time in education. And I've seen a lot of people not tolerate different workplaces. Like if it's no fun after four weeks, they want to change. And that's just, I think, how younger folks are. My question is, and we've touched on it.
Jeffrey, before you begin,
Yeah.
I wanted to ask you, did you want to step on 9 of the toes or 10 of the toes? I love that statement because it is very true with the current generation in society, that there is that instant gratification and perhaps not as much of value in working through it, but there are reasons for that. But I definitely agree with that statement. Thank you so much.
Yeah, I try not to step on toes anymore.
Sometimes you need to.
What I do is, and I find in coaching high school kids or working with graduate students, you offer them a challenge. This is your challenge. It's not criticism, it's a challenge. And they seem to buy into that. You don't want to talk to them about what their problem is or be critical in any way because they're a little sensitive. But my question is, we've talked about it, state OT associations and AOTA has way too many volunteer leader positions open every year. RA races often don't have anybody nominated. And if they do, the quorum of votes doesn't get to 100. So they got to repeat the elections. What can we do to get people of all ages? I think people who are older are a little tired of holding together state associations or participating in a variety of different organizations. too much, too long, and we have to get younger folks involved. So any suggestions there?
Yeah, I would say first, thank you for bringing that up. I think that's a great point. And to that, I always say, and just speaking from the AOTA perspective, we are all AOTA. So I think the more that each one of us can communicate the value that we get from the association, because value for me might be different from value to you or value to Dr. Covington. So being able to communicate that to people and really working within our circle of influence. I think that's really the best way to start. Yeah, again, being able to communicate that value, embracing that, AOTA is the organization in DC, but we are also all AOTA, and we all play a part in getting people involved and keeping people involved by sharing our personal stories.
Thank you, Jamar. Delvin, you have a question? Please feel free to unmute yourself.
Hey guys, can you hear me?
Can hear you loud and clear.
I'm actually driving, so I'm I gotta be careful here. Leaving, we live in La Crosse, so it's always every day. So this is a rich discussion that we're having here. But one thing that I have emailed AOTA about this over these since pandemic about what do we do with OT practice website. I'm sorry, OT jobs link, the OT jobs link. We have a great tool that I live in near DC, and if I type in, I'm licensed in DC, Maryland, and Virginia, and if I type in jobs, like a fieldwork coordinator position from like George Washington comes up, like one job. I'm like, what are you talking about? Like, so what I had an idea, I wrote it up, I sent it to AOTA a few years ago. It is an idea that we can utilize an already existing organized site to add jobs that are in these roles. Like, like if I think that could be a huge way to drive membership if members, if they knew that they had access to jobs that were non-traditional roles where we can expand our practice and we can get OTs in some of these leadership roles if they were consolidated in a filtered place there on the site in different states. I think members having access to these jobs would be a huge boost in membership. Like, this is a way to drive membership. If we're in a new age and we want to try different things and we want to expand our practice, we want, we should know where those job searches that Jamar talked about, those jobs in every state should be on OT practice. Like, have someone add those jobs to the OT practice. And if you have access to that non-traditional, link, area on OT jobs link through your membership, like that would be a huge boost to membership. And so I would love to, talk to all the leadership, who are on the call about my plan. I sent this email several years ago about an idea that I had to do this, and I would love to work with AOTA to expand the OT Jobs Link website so we can have access to some of these positions and leadership and clinical roles that we can expand our practice. Thank you, guys. Thank you, Jamar, for this keynote. Have a great day, guys.
Absolutely, thank you. And again, I appreciate your comment. I can't speak to the job links page, but I will be happy to follow up with you via email about that.
Thank you, Jamar. Jamar, one last question for you. It's from Dr. Covington. In your role with in the AOTA currently, how do you ensure that occupational therapy is integrated into national discussions on quality and value in healthcare?
That is a great question. How long do we want to stay here?
Go for it.
So I will say one of the things that we do, again, kind of going back to looking at the U.S. healthcare systems, and there are so many organizations that are looking at quality now. We know that when we focus so much on volume of services, the quality piece isn't there necessarily. So we're trying to change that. And in trying to change that, the organizations that look at that are looking at what we call quality measures. And those are the tools that we use to measure healthcare processes and outcomes. So one way that we as AOTA make sure that we have our voice in those national conversations is getting people in the room. So when they're talking about those quality measures, or the home health value-based purchasing program, where they're looking at paying for or adjusting reimbursement because of value, we've got OT practitioners in the room shaping those conversations. So that's a short answer to your question. And to that, going back to what Mr. Loveland said about involvement. A lot of times when we're looking at people to be on those, they're called technical expert panels, we source those from the communities of practice and people that are volunteering with the association. So again, that's one of those things that we might not, or people outside of the association might not be so aware of them. And that's why it's important to be involved, because of opportunities like that.
Thank you, Jamar.
Absolutely.
Excellent response. With that, I'm going to transition us now to our President, Donald Howard, for some closing remarks and to wrap up our event.
Good evening, everyone. Thank you, Mr. Brother Jamar Haggans, for that phenomenal presentation this evening. We thank you for being our 4th annual keynote speaker, and appreciate the role that you serve at AOTA, and for sharing with us on tonight your wisdom and your journey to quality. A few of the takeaways that I gleaned from what you shared tonight. Number one, you mentioned you are enough. And I think that goes without saying. We need to hear that as often as possible, because that is just a confirmation and affirmation in current state of time. We need to hear that. Another takeaway that you shared tonight, we must engage. Start where we are and then spread out from there. But we must engage, and we must be able to have the dialogue and have the conversation. So appreciative of you saying that. And I too share your same sentiment about in leadership, not having enough financial education coming out of OT school. But I like your statement on tonight. There's no mission without a margin. And I think we need to really embrace that fundamentally. I know sometimes we hang our hat on productivity, and then we kind of get a little gloomy-eyed and weary, but that is a true statement. No mission without a margin. But thank you again for being our keynote on tonight. And to our attendees, we thank you for your time and sacrifice to participate in another Brothers event. We couldn't sponsor these events without your participation. We thank you for your support of our activities, and we greatly appreciate how you lend that to us. The previous slide did mention our executive board, and if ever there are any questions or statements you'd have for Brothers and our efforts to provide programming, we certainly would appreciate that feedback. But we're not going to hold you all any further on this evening. There is a link to our survey. It is posted up there. It's also in the chat. If you wouldn't mind completing that survey, we'd greatly appreciate it. And if nothing further, I'd like to thank all of you again for attending tonight's keynote, and wish you well as you continue and finish out your work week. Have a great night, everyone.